I'm back. Sorry, I lost signal. So hopefully the signal will continue to stay, and I look at the camera which is there. Turn the radio off. So yeah, mummy makeover, I'm going to talk about today, as well as fat grafting to the breast. Mummy makeover is not a term that I like very much. I think it's spelled M-O-M-M-Y, which I've written in the description of the last one that got cut off. I think it's it's an American thing, isn't it? But anyway, that's what they call it, and basically it means having a tummy operation and a breast operation. So tummy tuck and something to your breast, whether it be a mastopexy or breast implants with mastopexy or whatever. So we've had a couple of questions around that. One is what order to do them in and whether you do them together. So it is perfectly reasonable to do them together, and a lot of people do them together. I've just done them together just now, but that is one of the reasons I'm late, because it is a long op. Now, we did start a bit late today, so I thought I would be on time for the Facebook Live. Otherwise, I would have put a message out to say I was going to be late, so I'm sorry about that. But I couldn't get a message out because I've been scrubbed well, not all day, but most of the afternoon. So it is a big long op, 5-6 hours long, and it is a big deal, so it may not suit everybody. Having said that, it is just one recovery period, so that is the good thing about it. And a lot of people can't take time off work, so one of the questions is how long between operations. I normally say 3 to 6 months between the two operations. So just as you're recovering from one, then you have the other one. So you're looking at like a year or so to get better from it all. So the recovery is prolonged if you have it in separate operations, but it is the complications are less if you have it as separate operations, because you are only having the complications for your tummy or your breast. The complication rate isn't necessarily more by having it all done in one go, but you've obviously got risk of complications for your tummy and your breast, so you're sort of adding up your complication rate. So it is perfectly reasonable to do, and I can understand why people want it to be done because of the recovery and time off work, and just have one, basically while you're recovering for your tummy, your breasts are healing. But it is a big deal, and so we will go through that. The question was, which one would you do first? I think what that means is if you're having them done at separate times. So the answer to that is, I would say to you, which one bothers you more? So if your breasts bother you more, get them done first. If your tummy bothers you more, get that done first. I don't think there's any benefit in doing one over the other. I don't know if that was all talking about doing the operation, which one you do first, which is, I guess, pretty irrelevant to most people because they just wake up having them both done. But if you're interested, I do the breast first, and then I do the tummy, mainly because you have to break the table when you do the tummy, and so the patient's in a funny position when you're doing it at the end of the tummy tuck, so it's just a bit awkward to do the breast with the patient in that position. So that's why I do the breast first. But if you're having it at different times, yeah, do whichever one bothers you first. There's a lot of people on this one. Is this a better time then? What time is it? 8:45. God, there's more people than normal on this, or at least got more eyeballs on it. So, flipping it. Oh, God, sorry. I'm messing with the phone too much. That's flipping heck. 8:45 then. Maybe I'll do it later in the future. So yeah, tummy tuck. Did I have more to say about that? So yes, tummy tuck with breast surgery is a reasonable thing to do, and it is slightly cheaper because there's a discount when you have multiple procedures done. So there is that. So lots of things to take into account, really, I guess. And so we can all talk about this sort of stuff in the clinic, and yeah, so that's that one. So next one is the fat grafting. I was going to about fat grafting to your breast. Fat grafting to breast is a good thing to do. Something I used to do a lot of. I used to do fat grafting basically pretty much every week when I worked in the NHS, because I did breast reconstruction in the NHS, and it's very good for breast reconstruction because it gives a three-dimensional reconstruction of a contour defect. So if someone has a wide local excision of a tumour or something, or if you have a breast reconstruction and it's not looking quite right, fat grafting, you can place the fat exactly where you want it. So it's excellent for that. It can be used for breast augmentation, so you can have breast augmentation, and there is certainly people who don't want implants. I don't know if you're here, Amy, but I know you've got worries about implants. There's a lot of people who worry about implants. I have to say they've got a very low complication rate, implants, but nevertheless, they have got a complication rate, so people are worried about them. People are worried about things like the illnesses that we were talking about last week with Amy, which haven't been shown to be associated with implants, but some people say they get ill with implants. There are people who don't want them, and so fat grafting in those situations is good. So I think fat grafting is a good thing. The problem with fat grafting is that it's often small volumes, so you can't get big volumes, big predictable volumes of fat grafting, therefore often needs to be repeated. So that's the main thing to be aware of really with fat grafting, that it does need to be repeated, but once it's there and once it takes, it's your fat, so if you put on or lose weight, it gets bigger and smaller with you, so that's good, but the results are often subtle. As I say, I've had some excellent results with breast reconstruction, but then you're operating on, then you're operating on just one side of the breast. Obviously when you're doing cosmetic augmentation, you're doing both sides, so you have to put the fat in both sides, so you have to harvest twice as much fat, and it's not like normal liposuction where you harvest fat under high pressure and you suck loads of fat out. You do it under really low pressure because you want the fat to survive, and you have to process the fat before injecting it back in. The other thing, often people who want a breast augmentation are often slim, so they don't have many donor sites, so you've got to have a donor site where you're going to take the fat from, usually the tummy or the hips or the outer thighs. But it is something that is available, and again we can talk about it, but you have to be prepared for a more subtle result than you would get with a breast augmentation, where you can predictably say, look, you're going to have 200 cc's, 300 cc's augmentation. With a fat grafting, you're looking at 50 to 100 cc's per side, which is quite subtle compared to a 200 cc implant, which isn't that big, but it's it's there, and it's 200 cc's predictable. That's the other thing I wanted to talk about, is that I've done a couple of cases yesterday, and something that struck me is that we had some discussion about the implants before the surgery, and I saw some of the patients multiple times, had conversations on the phone with them, and there was a change of implant order in a couple of the cases. And just something I wanted to say is that I think it's really important that you feel comfortable phoning and having a discussion about your implant choice, and I always encourage people to. It's never great to change the implant order, to be honest with you, and theatres don't like it, and lots of people don't like it. But it's far better to do that than to think, I don't want to bother them, I don't want to bother him, I'm going to just, this implant will probably be fine. Both times we changed for quite a subtle change in the implant order, just one up or one down, and it probably will make a huge difference, but I think psychologically it makes a big difference that the patient feels that they're getting the right choice, and often they wouldn't notice that much. I felt very comfortable with both of the changes that we made in the two patients, and I think that it was a good move, and I'm really happy with the implant choices in both situations. I think they would have been fine before, but I did say to them, look, I'm not perhaps you want to go for this other one, and after some reflection and some discussion, we've changed it in both situations. So I just want to say I think it's important that people. The reason I thought about it is because we had an architect, we had an extension done, and we saw a couple of architects, and one came very highly recommended, but he was very matter of fact. He was very almost how it's done. The other one was much more amenable to conversation, to changing things, and I think, it's a similar sort of thing, I guess. If an architect, you think, I don't want to keep the wall there because we don't want to upset them or upset the builder, but it's your house, you've got to live in it for the rest of your life, and if you want the wall to be moved a bit, or if you want another window put in, you shouldn't be You should feel comfortable being able to say to the architect or the builder, can we talk about putting another window in? It might be that you don't put the window in for whatever reason, but you've had the discussion, then psychologically you can deal with it a lot better than if you feel frightened to say to the guy, can we put a window in? And the rest of your life you'll think, geez, I wish you'd put a window in there. Similar sort of thing. I hope you appreciate that analogy. Just thought of that just then. So make sure you can speak to your surgeon and change your implant order if you want to. But I don't think not saying everyone should do that, because it's not good to change it, certainly not close to the surgery. So I'm going to try and swipe this very gently to see if I've got any comments. I've got loads of people on, but no comments. Right, okay, it's all right. It's cool. Don't need any. You don't have to comment if you don't want to. That's fine. But it's not necessarily a comment. It's really a question, because I have actually got off this in the past, and there's been questions there. I don't know if that's because the Wi-Fi is slow. The Wi-Fi cut out earlier, so I think I've got Wi-Fi issues. So if there are questions there, and I'm just not seeing any questions, so I'm just gonna gently ease away and move off the broadcast, and hoping I don't, like I did, in fact, was it last week I came off and found like 3 questions. If that's the case, I am going to answer them there and then, and I'm not being rude by ignoring them. Well, maybe I am being rude, but I'm not I'm not knowingly ignoring any questions, because I am not seeing any questions. So I'm going to clock out in a minute. I'm going to finish this thing, clock out, go home, put my feet up, have a bowl of Weetabix, and that'll be me. Oh, no, I'll go there. Well, that's me. I can write. Oh, look at that. I can write a question. Okay, that's good. Notice that feature there. Swipe left. Okay. Right. Okay. Before anyone else comes in, I'm going to check out and say good night. Sorry I'm late, but I'm pleased that so many people are here, and it's nice to see everybody, as it were. So checking out, and have a good evening. Bye.